Hello, this is Tim Takaro. I'm a physician scientist with the Planetary Health Research Group in the Faculty of Health Sciences at Simon Fraser University. It's a pleasure to be able to offer a breakout session for you today. This session will focus on the question, how should Canadian public health respond to the climate emergency? Of course, the health impacts of climate change are many, and we will not be able to go into great detail on all of the health impacts, but I will cover some of the changes in vector ecology, air pollution, increasing in allergens, and severe weather events that are major impediments that we can face in the future due to climate change. Of course, we are all very distracted by COVID-19 these days. So COVID-19 pandemic and the opportunities provided by our dramatic response to the pandemic will be explored. This is a meme that came out very early in the pandemic where it was clear that people were quite frightened by the prospects, correctly so, and agreed to do many things that they would not otherwise have done. And this meme describes the dramatic changes that people made in their lives to try to reduce the impact of COVID-19, reducing travel, reorganizing my entire life. But when it comes to climate change, the meme is different. The life of young people will be a living hell from climate change. To reduce the impact of climate change, I should use clean energy, fly less, and rethink how I travel. But this is something we've been asking for years and have barely budged on. Why is that? COVID-19 has disrupted many things, but its emergence is actually from disrupting nature. There are the proximate socio-ecological determinants. There are upstream causal factors, including disruption of habitat. And there are the opportunities for preventing the next pandemic. And we'll explore all of these in the context of climate change. So what is it about the human incursions and disruption of nature that produces a pandemic? We will examine, with help of Professor Raina Plowright, how human spillover events occur, where zoonotic diseases are transferred, sometimes even between species. In this case, it seems that way with COVID-19, and eventually infect humans. Now, this is a complex series of events that have to all line up in order for human exposure and our normal defense barriers to fail. But in a spillover event like with the SARS-CoV-2 virus, these all happened. What we're doing with climate disruption is creating the conditions that make such spillover events more likely. And we'll explore that in many of the facets of climate change impacts on human health and the opportunities for achieving co-benefits in public health by preparing better for the next pandemic and hopefully preventing them by our actions related to climate change. Here you see New Delhi prior to the pandemic on the left panel, and in late March on the right panel, where the air was cleaner than people remembered ever seeing it. This is one of the openings that we see for bouncing back better uh, not just settling for bouncing back to the way we were, but bouncing back to a future with less air pollution, with less greenhouse gas emissions, and with more active transport, better food supply that is locally sourced, and more robust and equitable responses to the stresses of both a pandemic and the future stresses of climate change. Why don't we treat climate change like an infectious disease? Climate change is also a global health emergency, which we in public health must address. Thank you.